Hello students, welcome back. This is Dr. Radhika. I'm your community medicine educator on the Medicoz community platform. So today we'll be discussing the NEET PG 2023 recall session on the questions in community medicine. So on analysis of the questions from community medicine, it was found that majority of the questions were easy, some questions were tricky, and very few questions were controversial. So we'll discuss each of these questions a little bit in detail. If you have any queries or comments, feel free to put in the chat box. So without much delay, let's go to the first question.
So the first question is the vaccine given to a 10-year-old child. So this is a direct question, easy question. Option A is measles, option B is the TD vaccine, option C is rota vaccine, and option D is hepatitis B. So if you know the national immunization schedule, you know that measles is given as MR at 9 months, and then a booster dose is given at 1.5 years. Then we have the TD vaccine, this is the tetanus, diphtheria, toxoid. The rota vaccine that is given at 6, 10 and 14 weeks. Okay, and hepatitis B is also given as Pentavac at 6, 10 and 14 weeks. So that is not the answer, rota is not the answer, and MR is not the answer. So TD vaccine, you know, that is given at 10 years and 16 years in according to the national immunization schedule. So this is a very easy question and direct question from the national immunization schedule. Option is option B. Moving on to the next question, the symptoms of diarrhea, dementia and dermatitis are seen in the deficiency of which of the following? So you know that the 3 Ds is a very important question that has come multiple times before. The 3 Ds is seen in the disease called pellagra, diarrhea, dementia, dermatitis, and there's also death, 4 Ds. And pellagra is caused due to deficiency of vitamin B3. So if you know this, then you know that vitamin B3 is niacin, and the option is option C. It's a direct question. And this Cassell's necklace is again another representation or clinical sign that is seen in pellagra due to dermatitis. The Cassell's necklace is seen. So again, please students, please remember that this is an important question and repeated many times. Next question is, a factory worker presented with mesothelioma in chest x-ray. What could be the most possible cause for the same? So mesothelioma is actually a cancer of the lining of the lung, and it's an occupational disease. So the options here are byssinosis, silicosis, anthracosis and asbestosis. So byssinosis is caused due to exposure to cotton dust. Silicosis is direct, it's due to exposure to silica. Again, anthracosis is due to coal dust, and asbestosis is caused due to exposure to asbestos. So this mesothelioma is directly related to asbestos exposure, and that's a direct question from the occupational health topic. So hope many of you have got this right. Moving to the next question, which of the following would be the ideal choice of contraceptive for newlywed couples? So note the point that they have asked for ideal choice of contraceptive. So when you say ideal choice, you must choose the most appropriate answer. So ideal choice is the key word here. So you would feel that any of these can be given. Copper T can be given, or condom can be given, OCPs or DMPA injection. Especially the doubt would be considering condom and OCPs. But please note that for a newlywed couple, the most appropriate or the mostly given contraceptive is combined OCPs, which is available in the government setting also as Mala N or Mala D. So the ideal choice is OCPs. You can argue that they can take DMPA or condom and so on, but I would say the most appropriate answer is combined OCPs, option A. The next question, in the outbreak of suspected waterborne disease, a water sample for bacteriological investigation would be collected in the following way. So when you're having a waterborne disease, or when you want to collect a water sample in order to identify E. coli or the organism, if there is presence of any other organism in it, there are certain guidelines that are to be followed while collecting the water sample. The first thing is that the bottle should not be kept close to the tap from which we are collecting, because the opening of the tap itself would be contaminated. So even if the water is not contaminated, sometimes we can get false results. So the bottle is to be kept not close to the tap, it's to be kept far away. So that is not the option. Again, another point to be kept in mind is that water should be collected from properly working taps and pipes and not from leaking ones, because leaking pipes would anyway have multiple contaminations. So water should be collected not from leaking taps, should be collected from the properly working closed pipes and taps. The next option is allow water to run for 1 minute and then collect, and collect water from a gentle stream to avoid splash. So there would be a lot of confusion between these two options, and collecting water from a gentle stream to avoid splash is correct. And actually, if we want to collect water, we should allow the water to run for at least 2 minutes is what the guideline says. So we should allow water to run gently from the tap for 2 minutes and then collect. So in that, considering that, the option C also would be ruled out, and the most appropriate answer here would be option D. So many students would have got confused between C and D. So again, going for the most appropriate answer, I would say that option D would be the right one. Moving to the next question. During the antenatal visit at 8 weeks, a pregnant woman was found to have hemoglobin of 9 grams. When will iron folic acid tablets be started for her? So here a very important concept that is to be understood is when iron should be given or started for treatment of anemia in pregnant woman, and when should iron be given or IFA be given if we want to give for prophylaxis. Prophylaxis means the HB is normal and she is not having anemia. So the timing of starting IFA, these two are different. For prophylaxis, that is if a hemoglobin is normal, we start iron after 12 weeks. Because in order to avoid the gastritis and the motion sickness that she already has would be aggravating. That's why we start after 12 weeks. But for treatment for a person who is anemic, iron should be started immediately. Okay, immediately. There's no waiting in that scenario. So considering these 2 points, we have to see where this woman falls into. She is 8 weeks and she's having a hemoglobin of 9 grams. So it's very clear that HB9, she is anemic. That means she should be treated immediately. So the right answer here is option A, as soon as possible. Okay, please don't get confused, because in prophylaxis we give after 12 weeks, but when she's anemic, the iron should be started as soon as possible. Moving to the next question. According to the Colombo plan, which of the following is true in the treatment of cancer? So Colombo plan is from the International Health chapter. If you have read it in detail, you know that strengthening of manpower and chemotherapy units and cobalt units, multiple answers here would look correct to you. But if you remember what is written in the Park textbook, cobalt units, therapy units are given to the medical institutions in the Colombo plan. So the most appropriate answer out of this would be option D, cobalt therapy units. So please remember, it's easy to remember, Colombo plan, cobalt therapy units. There's a clue, CO. Okay, so option D is the right answer here. So this next question, which of the following vitamin deficiency causes night blindness? Is the very simple, I think the most simple question in the paper, directly which you have learned even in your school days. Vitamin A is the right option. Vitamin A deficiency causes night blindness. There's no confusion in this question. And moving on to the next question, the average daily nutrient intake level sufficient to meet the requirement of almost 97 to 98% of healthy individuals in a particular stage of life and gender group is known as. So we have four options: average nutrient requirement, dietary goal, recommended daily allowance, and prudent diet. So the nutrient level sufficient to meet the requirement of 97 to 98% of healthy individuals is actually what is known as the RDA, or the recommended daily allowance. It's actually the direct definition that is taken. So right answer is option C. Whereas prudent diet is different. Dietary goal is actually what is given by the WHO in order to provide a balanced diet, or how to prepare a balanced diet. And average nutrient requirement is also not the right answer. So we go for recommended daily allowance, which is option C. Moving to the next question. A baby delivered by full-term normal delivery as seen by low birth weight, premature, is seen to have low birth weight, is premature and has cataract and patent ductus arteriosus. So what could be the most probable cause of this condition? So you know that patent ductus arteriosus, cataract, prematurity and low birth weight, everything together falls into a condition known as the congenital rubella syndrome. Again, this is an important question that keeps getting repeated. Please remember, congenital rubella syndrome is the answer here, and the causative organism is the rubella virus. Okay, it's an important question, direct question. The next question is, years of potential life lost could be. So in this you need to know the concept of DALY, or disability adjusted life years. So DALY is actually the sum of YLL plus YLD. YLL stands for years of life lost and YLD is years lost to disability. Okay, so here this years of lives lost is what is actually premature death. Okay, premature death. That's what that's the concept that you should understand to answer this question. So years of potential life lost could be years lost to premature death. That is the right answer here, option B. So please understand the concept of DALY and YLL and YLD. They keep coming in different ways in the question papers. Moving to the next question. The best indicator of development in terms of availability and utilization of healthcare of a country is. So they're looking for both healthcare availability and healthcare utilization. The options are DALY, HDI, IMR and immunization coverage. So here you should know that DALY is a direct indicator of disability. HDI is an indicator of quality of life and standard of living. Infant mortality rate and immunization coverage would be the doubt. You would be having doubt between which of these two are the right option. So immunization coverage is actually an indicator of utilization of healthcare resources. But whereas IMR, or infant mortality rate, is the actual answer here, which is the best indicator for showing the availability of healthcare resources and its utilization. So IMR is the best answer here, option C. Okay, moving to the next question. A study was conducted to identify the association between aniline dye exposure and bladder cancer in factory workers. Two groups were formed, of which one group of workers had dye handling and the other group did not have exposure. The details of work done were taken from the previous records. What type of study is being done here? So as you can see, it's from the epidemiology chapter, and the key terms that you should remember are that two groups were taken and one group of workers had exposure to dye handling. They did not have the disease. They had an exposure. So when you follow up a group having an exposure you know the study design is what is known as cohort study. So the group is the people having exposure to dye handling and not having the exposure to dye handling, and they get followed up in order to see whether they develop bladder cancer. That is the study design. So it's pretty sure that it's a cohort study. Now as you can see in the options, there is retrospective cohort and prospective cohort. So again, there's another key term that has come here. The details of work done were taken from the previous records. Okay, so previous records is the key term, which shows that they have gone back and selected records and then moved forward to look for bladder cancer. So when you go back in time in a cohort study, it becomes a retrospective cohort. That is the right answer, option A. Please note that the presence of the data taken from previous records is the key point here to identify that it's a retrospective cohort study. Moving on to the next question. A patient suspected to have tuberculosis was found to be sputum negative, but chest X-ray shows signs of tuberculosis. What is the next step in the diagnosis of the patient? So this is again from the TB algorithm, and here you have identified that the person is sputum negative and chest X-ray positive. So we'll go to the algorithm to see what is to be done as the next step. So this is the TB algorithm, and you can see that there are many scenarios. There is sputum and chest X-ray positive, sputum positive but chest X-ray negative, sputum negative, and chest X-ray positive. So the third one is actually our scenario where sputum negative and chest X-ray suggestive of TB. So what you need to understand here is that in any of these scenarios, any of these mix and match scenarios, the next step in the diagnosis would be the same, that is CB-NAT, which is a gold standard for testing of TB. So the answer here is pretty simple and direct. The answer here is option C, that is CB-NAT. So sputum negative, chest X-ray positive, the patient should next be sent for CB-NAT testing. Option C. Moving to the next question. The blood pressures of children were noted and recorded till they become adults. It was observed that those who had low blood pressure in childhood had lower range of blood pressure in adulthood, while those with higher childhood BP had higher pressure as adults, blood pressure as adults. This can be best described by. So here there's a phenomenon that shows that as the age advances, the blood pressure if it was high in the childhood, there's a trend that it keeps becoming higher and higher in the adulthood also. So lower blood pressure in childhood means lower blood pressure as adults. Higher blood pressure in childhood means higher blood pressure as adults. So that is what is known as tracking of blood pressure. So this concept is known as tracking of blood pressure. It's a very direct and simple question. I hope most of you would have got this right. Next question is, a patient with fever and swelling of lymph nodes was positive for filarial antigen. The next step in diagnosis would be. So this was a confusing question for many students, because any of this can be done. Peripheral smear can be done, or DEZ provocation, or lymph node biopsy can be done. So what would be the most appropriate or the practical answer, I would say. Practical answer in this scenario is what would be done in the field. So you should know that in a field, the testing for filariasis is done by a healthcare worker, male health worker, and what he usually does is the peripheral smear. So I would say the most appropriate answer or the most practical answer here would be peripheral smear for microfilaria. Okay, so I think there would be many queries regarding this question, why not a DEZ provocation. But the answer is the same. The most appropriate or the best answer among the four would be peripheral smear for microfilaria. The next question. A young patient comes to the OPD with a clean cut wound without any bleeding. The patient has received full course of tetanus vaccination 10 years ago. What is the best line of management? So there are two key terms here that you should identify. The first thing is that it's a clean cut wound, and the next point is that the patient has received full course of vaccination 10 years ago. So with that, we can categorize the patient to decide whether he should receive the tetanus vaccination or immunoglobulin. Okay, and you can look into the box. So if the person has taken his tetanus vaccine more than 10 years ago, then and he has a clean cut wound more than 10 years ago, and he has a clean cut wound, then the tetanus toxoid, single dose of tetanus toxoid vaccine should be sufficient for him, because he has taken the full dose previously, but it is 10 years ago, and that is the reason the answer here would be giving a tetanus toxoid shot, single shot. So the best line of management here is option B, that is a single dose of tetanus vaccination. So here you have to learn the different categories A, B, C, D as to how you categorize the person based on when he has taken his last tetanus shot, and whether the wound is clean cut or an infected or open wound. So according to that, the choice of vaccine and immunoglobulin should be done. Here the option is option B. The next question, a young lady comes to the STD clinic with a vaginal discharge. On speculum examination, she was found to have cervical erosions. Which kit should be given to her? Okay, so again the important terms to be noted here is that she has vaginal discharge, or she has come with the complaints of vaginal discharge. But on speculum examination, she was found to have cervical erosions also. Okay, so this is the confusion that has arisen among students, because many of them would have thought that, okay, vaginal discharge, we go for the first kit, but as the next sentence says that they have identified erosions, what we should be predicting is that this vaginal discharge is a part of the cervical erosion, and we should consider it as a cervical discharge or cervicitis. Okay, so that is the clue to this question. We have discussed this in our previous 25 most important MCQs also, that if we have a cervical discharge and a vaginal discharge, the kits to be given are different. For cervical discharge, it is kit 1, whereas for vaginal discharge, it is kit 2, that is a green color. So many students would have thought that, okay, vaginal discharge, the option is green. No, here since they have identified the cervical erosion, we cannot ignore it. So please remember that here we should consider it as a cervical discharge and give a grey kit. So the answer here would be option A. Grey kit is to be given to the woman because the cervical erosions were identified and the discharge would be a cervical discharge. I hope that is clear. Please read every line in the question in detail. That is the important message from this question. After reading the first line, we would think that, okay, it's a green kit, but remember, when you see a cervical erosion, you should change the kit to grey color. Okay, so option A, grey, would be the right answer. Next question is, a child of 14 months presents with scaly pustular lesions in the perioral region, diarrhea, and there's history of poor wound healing. Which micronutrient deficiency is present? Okay, so the options are selenium, zinc, copper, and iodine. Certainly iodine would be ruled out because these symptoms are not seen in iodine deficiency, and selenium also is not the right answer here. There would be a doubt between zinc and copper, and in that case, what history of poor wound healing and diarrhea is all directly reflecting onto deficiency of zinc, and zinc deficiency is more common and seen among children. So that is also a point towards getting the answer right. Okay, so zinc deficiency is the one that is more common and results in the perioral lesions, diarrhea, and poor wound healing. So please remember to read this micronutrient deficiency areas in detail, because questions do keep coming from this, especially zinc, selenium, etc. Next question. It is noticed that farmers in a village had crossed gait, spasticity, and used sticks for walking. They said that the crops had failed and people were consuming rice and locally available pulses only. Which vitamin supplementation can prevent this condition? So as you can, what you should identify is that there's crossed gait, spasticity, and using sticks for walking. All this is directly pointing towards a particular toxic condition. And they also say that the crops have failed and they're using locally available pulse, which could be the kesri dal that they are pointing towards, and the issue would be neurolathrism. Okay, so neurolathrism is a condition that is explained here. And you know that in the treatment of neurolathrism, which vitamin is given, students? The vitamin C is given to prevent neurolathrism. So vitamin C is the right answer here. So it's a little a tricky question where you have to identify that this is neurolathrism, but there are multiple clues given. So whenever questions are given, please try to identify the keywords that will lead you to the answer and read the question completely before answering. So the answer here is vitamin C. Okay, the next question. A pregnant woman presents with night blindness as she has been avoiding papaya, mango, and other fruits during her pregnancy. Which of this, as her family told that it was not good during pregnancy, which of these following staff has the duty to counsel the woman and address the issue? So again, this was very controversial. Many students have written multiple different answers, because all of these, the ASHA worker, the Anganwadi worker, the ANM, all of these people have the right to, or they should be advising the pregnant woman regarding the myths of not eating papaya or mango and fruits in pregnancy, and they should, all of them should be addressing this issue. But the question here is, who has the duty to counsel the woman? Okay, who has a written duty to counsel the woman? Then we should be looking for the most appropriate answer. And I would say that the most appropriate answer here would be the ASHA worker, because she is the person who goes for home visits. She goes for home visits, and she is the person who picks up the antenatal woman, gets her registered, and does more work in the maternal and child health, especially with respect to the antenatal woman. Anganwadi worker is more concerned with the ICDs and the children, I would say, and ANM is not the person who is going to their homes and seeing them. So I feel the most appropriate answer here would be the ASHA worker, who has the duty to address this food taboo. Okay, because only during home visits you get that much time to speak to the women to address their myths and taboos. So ASHA worker would be the right answer. The last question is, a child with fever, rash, has come with fever, rash, and Koplik spots. Which of the following is the diagnosis? So again, I think this is a very direct question, because Koplik spots is pathognomic of measles. So measles would be the right answer here. And again, I would like to show you the picture of Koplik spots. Okay, so it's present near the first or the second molar as bluish white colored lesions in the buccal cavity. Okay, so they are pathognomic of measles. So it's again a very easy question that has come in the exam. So that's it with the NEET PG 2023 recall from the community medicine. I hope you put in your queries and comments in the chat box. Thank you.